Hello, everybody. Welcome to the 2025 Food and Friends Nourish to Flourish webinar. Our webinar will begin promptly at 1 p.m. And as a reminder, this session will be recorded. Thanks so much. All right, folks, welcome again to the 2025 Nourish to Flourish webinar hosted by Food and Friends. My name is Cameron Whitaker, and I am the Director of Communications here at Food and Friends. You are about to hear from Khadijah Ash, a former volunteer, a former employee of the DC Department of Health, who funds us, and a current client living with cancer. She testified on our behalf at the DC Council's Health Committee hearing, advocating for our funding to continue in a difficult budget year. And I think you'll agree that she did a great job of representing the impact we can have on someone's life.
Josh, yep. Thank you. Good morning. My name is Khadijah Ash. I'm a Ward 4 resident, and I thank you for the opportunity to share my support for and experience with Food and Friends. I'm happy to be here today, literally. I'm a two-time cancer survivor currently in treatment, and in my 74 years, I've learned the benefit and blessings of things we often take for granted, like eating. For 2 weeks during my cancer treatment, I was unable to eat properly. I lost over 20 pounds and my surgeries were being threatened. So my medical team recommended Food and Friends, and I was like, duh. I volunteered with them years ago, so do my children and my grandchildren. So I knew the organization, not thinking I'd be a part of their client list. When I worked for the Department of Health, Food and Friends offered us some meeting space and great hospitality. Now I'm on their client calls for social hour, and they're on Zoom and very convenient for us. Anyway, I expected good food, but either way, no matter what, Mama say beggars can't be choosy. But surprisingly, I got gourmet type meals based on my health situations. They even got me eating edamame. Cancer is not my only condition, however. I'm also married. With the with the fatigue that comes with chemotherapy, I was not able to prepare meals. So a big stressor for me was the burden of my care on my husband, Calvin. All that, everything, my care fell on him. By the way, he's a survivor too. Although I like hot dogs and beans, he loves hot dogs and beans. Food and Friends addressed all that, and they delivered us from that diet. As for their meals, I enjoy salads like chicken apple salad, soups like broccoli cheese soup, and dinners like diced chicken and wild rice with collard greens. The produce items are like Christmas. You don't know what you'll get, but you know it'll be good. There's also Glucerna for when I can't swallow very well. Thank you for funding Food and Friends. It's literally meaning life to me. They fill a need like no one else. No sandwiches, no cooking, no shopping, no cost, no shame, and no hot dogs and beans. Nothing but better health, mind and body. Hopefully Food and Friends will benefit from my testimony and make it more clear to you how essential their service is for support and nutrition that they offer. We're fighting for just the hope to be well, whatever that means for us. So as a beneficiary of their superior service, Food and Friends deserves and needs at least the $1.3 million you previously provided. Thank you.
Okay. Sometimes a client can tell the Food and Friends
Thank you.
story in a way that no one else can. And Khadija really exemplified that in her testimony. We were funded successfully, and I think, her words were a large part of what got us there. Hello, everybody. I'm Carrie Stoltzfus, the CEO of Food and Friends, and I'm going to get us started this afternoon. Most of what you'll hear today will come from Becca Kahn, our Director of Nutrition Services. I always love an opportunity to hear directly from our registered dietitians because they do such a great job at conveying what makes our services unique and special. A lot of us have never met with a dietitian, or if we have, it may have been for general wellness. So it's always fascinating to hear how our dietitians use their expertise with someone experiencing serious and complex health conditions to make a difference in their lives. So thank you for sharing that interest with me today. We have a wonderful group of supporters with us this afternoon. And while I can't recognize everyone, I would like to thank members of our giving circles for joining us. Our clients don't pay for our services, and we depend on your contributions to support our mission. Our giving circle members are those who make monthly contributions, those who donate $1,000 or more each year, or those who have made a lifetime or legacy commitment to support our mission. And we're grateful for all of you. At Food and Friends, we often say that anyone can get sick and everyone can help. And our donors and volunteers here with us demonstrate that every day. And so I hope you'll visit our website to learn more about giving and about volunteering. So in regards to what you'll learn today, I want to set the stage by just quickly saying a bit about how clients are referred to us. They come to us through a referral by their healthcare provider in most cases, or in some cases, their Medicaid insurance provider. So we at Food and Friends have relationships with hospitals, clinical networks, and hospice agencies across the metro region who identify and send their patients to us, as well as Medicaid managed care providers who refer their insured members with complex health conditions to us. I'm gonna briefly talk about how we approach taking on a new condition through the example of our two most recent expansions over the last few years, to cystic fibrosis and to sickle cell disease. And then I'm going to turn it over to Becca for the rest of the session to talk about our diets and our counseling processes. Can we go to the next slide? All right. Food and Friends was founded in 1988 as an AIDS serving organization, as many of you know, and we were part of a movement of agencies in multiple cities who were delivering meals to those living with AIDS. In the year 2000, Food and Friends became the first organization to expand our care to those living with cancer. At that time, people with AIDS were living longer with medications, but the treatment regimens were really difficult. People were taking many, many pills a day, some of which had really tough side effects, and some of the medications needed to be taken with food in order to be effective. There are parallels to the HIV treatment I've just described and to cancer treatment. For cancer, the disease itself is really difficult, the treatment is really difficult, and nutrition plays a pretty important role in the effectiveness of treatment. So that expansion to cancer made sense. This was a population in need. We had the ability to meet that need. Over all the years since then, the 25 years since then, we have continued to build on what we learned treating one population in order to care for another. And we've continued responding to what our community has said that they need from us. And of course, we have worked with healthcare providers who are experts in the conditions of their patients. So before I turn things over to Becca, I just want to say a bit about our two most recent expansions as an example of that. Next slide. All right. We were approached by the Cystic Fibrosis Foundation in 2021 to consider taking on that population. It's a disease that affects the lungs, and so it affects physical activity, including, the ability to cook and shop, but it can also affect how the intestines absorb food, which can affect weight gain and even growth in children. And CF can also increase the risk of diabetes and liver disease. So our dietitians met with the foundation staff to talk about the nutrition needs of someone with CF. Being underweight is more common than it is in the general population, so there was a need for more calories than the meal plans that we had available at the time. So we worked with them, our dietitians worked with them to develop a high-calorie meal plan. Those with cystic fibrosis also lose more salt than you or I do, so our low sodium meals were not necessary for this population. But the foundation agreed that we didn't need to focus on that because salt is so easy to add at home. And that was helpful because that enables us to use that same high-calorie meal plan for other clients without CF who need a low sodium diet but more calories. It was important, though, that the high-calorie meal plan that we developed for cystic fibrosis be healthy calories. At the point that we took on this population, they were at the verge of some really significant advances in treatment and medication that meant that people could live, years longer than in the past. And so how they get their calories is important to their future health. Next slide. In 2024, we were approached by Howard University Hospital's Center for Sickle Cell Disease after giving a presentation to a group of doctors at Howard. And again, through conversations with our dietitians, their clinicians made a case for the nutritional needs of the sickle cell population, the nutrients they needed to focus on, the need for a higher calorie diet, and the high incidence of kidney disease among those with sickle cell. In this case, when the experts at Howard reviewed our meal plans, they determined that the high-calorie diet that we had already created a few years prior and our dialysis-friendly diet for kidney disease that we've had for quite some time. So those two meal plans, either alone or in combination with each other, met the needs of those that they plan to refer. So in that case, we didn't need to develop a new meal plan in order to meet the needs of this new population. So those are just two examples of how, whether we need to expand our programming or not, we've been able to expand who we care for and how we do so. So from here, I will turn it over to Nutrition Services Director Becca Kahn to talk about how she and her team work with our clients, but I will be available with her for questions at the end. Thank you.
Thanks, Carrie. That was a great introduction to the work we do and have done recently. And thank you everyone for being here and taking a deep interest in the work that we do. So I'm going to dive into medically tailoring our food. And you can go on to the next slide. I'm going to talk about medically tailoring our food and the work we do to create the different meal plans that work for our clients. So what makes something medically tailored and how is that different from just healthy eating for the general population? The dietitian piece is really key here. So dietitians do a nutrition assessment, and that assessment is a time where we collect relevant medical information, labs, medications people are on, all things that might impact what someone can eat, or the timing of the food or the timing that they take their medication versus food, and really addresses an individual's unique needs. Healthy eating might be more general and promote that my plate method that you guys might be familiar with. And the nutrition assessment is also a time to talk to folks about, challenges they may have with eating that are unique to them or new, and it also will address their preferences and what they like to eat. Next slide. We have another way of visualizing that medically tailoring and how that's not really the same as prevention or addressing less acute needs. Dietitians, again, are medically tailoring. It's part of the healthcare system, and it's really seen as a healthcare intervention. Next. Oh, you can go back to that lovely picture of the nutrition services team. So this is us. This is our current nutrition services team. We are 5 dietitians. We all work with clients and we all work on menus and meals. Next. And this is just a visual of the nutrition care process. So when we say that nutrition assessment, that's just one piece of what's involved in that process of working with each client. As I mentioned, the nutrition assessment is really about collecting all of the relevant information, what impacts what somebody can eat, what they have access to, what they prefer to eat, and so on. And then moving along that circle, the intervention might be offering medically tailored meals or medically tailored groceries or medical nutrition therapy, or helping them identify a workable goal for themselves, which might be, are you going to check your blood sugar every morning or once a day or twice a day? And then we also always want to have something where monitoring what outcomes are we checking on each time we speak to them. How are the meals working? Has someone been able to achieve their goal of checking their blood sugar? Really evaluating the intervention we put in place. So this is the process we do with each client in addition to the menu work that we do. Next. And we couldn't do this alone. The nutrition team, of course, is key, and I'm very proud of the work that we do. But we really work very closely with the chefs and the whole nutrition team to develop all of our recipes. They bring the basics, they bring the creativity, they'll start with an idea of a certain chicken or fish dish, and then we take their creative ideas, put them into nutrient analysis software, we taste test meals together, and we'll adjust the recipes from there to meet our own nutrition standards. And then additionally, we collect feedback from our clients and we bring that back to the chefs and modify the recipes further from there. So it's an iterative process and an ongoing process. Next slide. So the collaboration with the chefs, again, they're bringing their expertise on flavors, but also things that you wouldn't think of, like the kitchen equipment. I always like to describe the kitchen equipment like conference rooms. You can't really double book a specific oven or the tilt skillet. So when we're thinking of, really fun ideas, the chefs will say, well, if we're making this on Monday, we really can't make this other roasted vegetable dish also on Monday morning. So we might have to just build out the menu based on the available kitchen equipment. So they really, again, will help rein us in when we get excited about, too many autumn roasted vegetables or something like that. Next slide. So how does that translate to all of our different meal plans? So these are the different meal plans we have for our medically tailored meals. We start each recipe together by building it for that medically balanced meal plan and discuss how we would need to modify it for each of these other meal plans. Sometimes that means we're able just to do one ingredient swap, and I'll show you some examples later on. That might even be just like subbing tofu for chicken as an example. And sometimes there are many ingredients that just wouldn't work for a vegetarian or a mild low fiber. And that's when I usually use the word Frankensteining. When we're Frankensteining that recipe too much to fit the restrictions of another meal plan, we just start from scratch for that alternative meal plan. And those folks happen to get a completely different meal from Medically Balanced that day. Next. So again, we start with the medically balanced. We think about the restrictions for folks with diabetes and or heart disease. So that means we're really thinking about the sodium, the balance of carbohydrates to protein and fat. We want a certain amount of fiber in there, and we always want a vegetable in the recipe too. We dive into the ingredients, and we, when Chef Rashid and I are looking at the ingredients we're buying, we really try to avoid problematic ingredients like high fructose corn syrup. And then again, we think about client feedback over the last set of surveys or focus groups. And we look for feedback about comfort food, what would help somebody who doesn't feel well feel better. And then we also just think about what would freeze and defrost well. Next. So how do we adjust, let's say, the medically balanced for mild low fiber, and who might need that food? So first we'll remove strong odors. So if it's a curry meal, we might, find different seasoning or Cajun seasoning or barbecue sauce, things like that. We'll try and remove. We try and limit the fiber to about 15 grams or 15 grams a day or about 5 grams per meal. And then we think about common reflux triggers like an excessive amount of onions or garlic or mint. And we figure out the right limit. So there could be some of that flavor, but it's not excessive. We'll avoid things like skin on potatoes. And similar to the onions or those reflux triggers, we think about what's kind of the limit if it's a mixed deal. Can we have some, skin on potatoes if it's really gonna make the meal better? And then who might need a mild low fiber meal plan? It's often, I would say, people going through chemotherapy or radiation. And we hope that people are on this meal plan temporarily, but for some, that's longer than others. Next, we'll talk about how we adjust our medically balanced for dialysis friendly. As Carrie mentioned, folks with end-stage renal disease who are on dialysis. So we look at how we can add protein because the process of dialysis really is harsh on the body and your body needs more protein. So sometimes that means just adding an extra side of chicken salad, for example. We also want to lower the potassium and lower the phosphorus, especially from additives. So for example, in this picture, you can see sweet potatoes. That might be in the medically balanced meal, and that is really, sweet potatoes are really high in potassium, so we want to sub that out for carrots as an example. Next slide. And then when we talk about texture modification, our pureed meal plan is really based on the International Dysphagia Diet Standardization Initiatives. So over the last 10 years or so, a group of dietitians and speech and language pathologists worked together for years to find safe food for different conditions and make sure that Internationally, we're all using the same language and same standards for testing foods and liquids for people who need pureed food. So pureed food, you can compare it to maybe the consistency of applesauce. People who might be on our service, it's often folks with Parkinson's or ALS or MS or folks on hospice for any reason. Sometimes it's also people going through radiation for a head or neck cancer. Sometimes it's people who are missing teeth or temporarily if they've lost weight from their treatment and they have dentures and they don't have their new dentures yet. They might be on pureed for a period of time. Next. So we can't do this alone, and as I said, so we work not just with the kitchen team, but the development team also. There are many people who are interested in the work that we do for cancer treatment in particular, so I wanted to dive into that a little bit more here. Similar to the collaborative nature that we have with all of our teams, the kitchen team I mentioned, the development team is really great about coming to us on the program side, the folks who work with clients more directly to help brainstorm ideas when they see something that might be a good fit. So they want to, let's say, apply for a grant with the American Cancer Society. They'll talk to us about ways that we could be good stewards of that money. And that's what we did together for the American Cancer Society. And one of the things we came up with is that it would be great for one of our dietitians to become certified in oncology nutrition. So there are many different certifications that or specialties that a dietitian can sit for an exam and kind of get additional knowledge. And you can move on to the next slide and we'll talk a little bit about why somebody would want to do it. So holding a certification in any specialty area, but for us right now, oncology made sense. It can establish oneself as a leader in that area and really just be an additional resource and a richer resource for patients or clients and also other dietitians in the field, in the community. Next slide. So to become certified in oncology nutrition, one first has to be a dietitian, and then you have to prove that you've already been working with people going through cancer treatment. I think currently it's about 2,000 hours, and you have to pass a pretty rigorous exam with, nutrition information and pharmacological information and all that good stuff. And then you also have to maintain your knowledge through continuing certification. Next slide. So a case study on how we put all of this work and knowledge into practice with our clients. I just, chose an example of a client. It might be a 54-year-old male who is referred by their oncology team. And we know they're going to be starting radiation and then doing chemotherapy for a head and neck cancer. So within the first 2 weeks of radiation, they're feeling they can chew and swallow without any difficulty. They start with us on a medically balanced meal plan. They speak to the dietitian after a couple of weeks and they're starting to have a sore throat, mouth sores, some pain when chewing. So we talk about whether soft or our pureed meal plan really makes sense. We decide to try the pureed meal plan and maybe we've added a supplement like Ensure, which sometimes is really helpful when folks have difficulty swallowing and getting enough calories in. The dietitian might also speak to the referring oncology team about some of these concerns, and the oncology team at that point might prescribe them a magic mouthwash or some lidocaine to make the mouth sores less of a bother, make it easier to eat, and maybe they'll also prescribe an appetite stimulant. Over time, the sores are healing. We talk to the client again, the dietitian speaks to the client again. Maybe they've stopped radiation, they're on chemotherapy infusions, chewing and swallowing isn't as much of a concern, so we switch to medically balanced, there's no texture modification, or maybe, if they lost weight at some point, we would switch them to high calorie, for example. So that's how we put all of that work into practice when we're actually choosing which meal plan to give to somebody, how we check in with them about what their needs are and how those needs change over time and how we can address those changing needs. So again, I want to thank you all for being here today and listening. I know we have questions that we've taken before, but I think this is the time we're gonna open things up to hear from you guys and address any questions you have.
Thanks, Becca. I do have some questions that I've already received, and I wanted to share the first with you and Carrie. Um, how do you tailor meals for clients who are from other countries and are looking for familiarity with their native cuisine?
Yeah, I love that question. Thank you, whoever asked that. So there are a couple things we do, and it's interesting here in DC because it's a really diverse region. There's a lot of people with different histories and come froms, as we've learned to say. So one thing we do is we have always taken client feedback in general really seriously, and sometimes that's about culture and sometimes it's not. So if it is, you know, a case where we're not meeting somebody's comfort food needs, one thing we do is talk about how to bridge that gap. For most folks, we're not sending 100% of, oh, they're asking to take down the slides. For most folks, we're not sending 100% of what somebody's eating in a week. So we'll talk to them about what they can add to the food that we're sending to make it more comforting. It might be a spice pack that we can send, or it might be helping them figure out ways to access other ingredients. And honestly, for some people, if they're waiting for, if they're just, you know, at a point where they're ready to try making food for themselves, groceries might be a better option. Again, they're still medically tailored, but they can have an easier time making that food comforting for them.
Buffy, you're on mute.
Thank you. Thanks for that answer, Becca. We have another question, and we've got a couple more coming in, so that's wonderful. What are the eligibility requirements to receive medical deliveries, and how many weeks or months does a person receive meals?
I'm happy to take that. In terms of what our eligibility requirements are, the first part of that question, we try to focus on health conditions that, you know, make it difficult for someone to cook and shop on their own. You know, Becca mentioned ALS or Parkinson's disease, and then also conditions that have dietary ramifications, special diets to follow, things like that. So she also at one point mentioned, gave the example of someone who's receiving dialysis for kidney failure and having to think about things like phosphorus and potassium, which I never think about. I don't know about any of you, but I don't have to think about that, so I don't. But these folks do, right? And it can be difficult to follow those requirements, particularly on a limited income, or with just, you know, the added burden of living with a really serious illness. So having a diagnosis of a qualifying illness, and I said a bit about what makes an illness a qualifying illness. So that's number one, they have to have a diagnosis that they're undergoing treatment for. They have to be nutritionally compromised in some way. So at Food and Friends, we see ourselves as being more on the treatment end of the spectrum as opposed to the prevention end of the spectrum. So for example, if I got diagnosed with prediabetes, I would not be eligible for Food and Friends. But if someone has diabetes, they're already struggling with it, maybe they have a vision issue, or, you know, they've been, you know, they're in a wheelchair, they've had an amputation, something like that. Really struggling with their blood sugar, that's the person who would be eligible. So when I say being nutritionally compromised in some way, they might be struggling to gain weight or maintain their weight. They might be experiencing nausea, like if they're going through cancer treatment, they might be too fatigued to prepare meals on their own. So they're already nutritionally compromised, or maybe having trouble chewing and swallowing. Becca talked about the puree diet. The third tier is activities of daily living. And, you know, often at the point that someone is at, you know, in the way that I've described it so far, they already are requiring assistance with some activity daily living. So by that, I just mean all the things that, you know, you or I might do around the house without giving it a lot of thought. Most often it's cooking and shopping, right? So if you're struggling to do that on your own, that's the point in time in which you're eligible for Food and Friends. And then Buffy, the second part of the question, I believe, was like how long people tend to be on. It does
Yes.
vary. We ask our clients to reapply for services at 9 months usually. And so at that point, if they still, you know, really meet the same conditions, or if they've, you know, declined further, they'll be eligible to renew. Though there's also folks who at that point are no longer going through chemo, are able to do, you know, better on their own, or maybe, you know, they're still on dialysis, which you're on until you get a kidney transplant, but they have learned from us how to manage their diet and manage their health. And so they kind of graduate and become able to manage this condition much better on their own than they were when they came to us. So 9 months is the length of time that you can be on before we ask you to renew. But people can opt out for any reason up to that point if they don't feel like they have to be on until then. But that's when we reach out and ask.
Wonderful. Thank you. Now, Becca, I've got two questions that are fairly similar
Sure.
that have just come in. One asks, are you able to tailor meals to address food allergies? And the second is, how do you deal with rare food allergies?
Yeah, good question. So we ask about allergies on intake when people are applying, and sometimes we can put somebody on a meal plan that eliminates those allergens, and sometimes the allergen is too difficult for us to manage and we know we're not safely able to remove those ingredients, or just the fact that our kitchen is the size that it is, cross-contamination becomes an issue. So at that point, we'll just have a conversation about whether, you know, with those allergies, we can address it or we can't and we're not the right service, or if we, you know, if groceries will meet the needs of that family.
Okay. I mean, it's great to have questions coming in like this.
Mhm.
So here's another, and I don't know who's best to answer this, so I'll let you all decide. What oral nutrition supplements do you provide? This person is asking about supplements because you mentioned Ensure.
Sure, I can take that one. We do also offer Glucerna for folks who are dealing with blood sugar challenges, and we used to offer Nepro, actually. I can see a question there, but it was not well used enough, so we stopped offering it, and we found most people did better with Ensure or Glucerna, to be honest. And then we also we try and teach folks how to kind of make something similar at home so they don't have to rely on it forever, because you know, you can often get similar benefits making a shake at home.
And then I have another question here. And what's the biggest challenge for registered dietitians when providing nutrition counseling for clients living with sickle cell disease?
Yeah, that's a great question. Thanks again for whoever asked that. I think one of the biggest challenges is really finding the right time to discuss things, because we might schedule a nutrition appointment, and sickle cell is one of those diseases where there's a good amount of unpredictability. You don't know when a painful attack is going to happen. So sometimes we schedule a nutrition appointment, but somebody isn't able to stay on the phone, or maybe they're in the emergency room. So that follow-up becomes really challenging.
Great. And I think, okay, we've got another question here. And this is someone that's just asking, what is Ensure and what is its target audience?
Yeah, it's a good question. So Ensure and Glucerna are nutrition supplements. So they're like pre-made shakes. They've got like a multivitamin in them. They are lactose-free, milk-based, so they're kind of a protein shake. And the target audience might be, you know, somebody who needs extra protein or extra calories, and they can't get it just by eating food. And I'll just say Glucerna is the version of that that's designed for folks with diabetes or who blood sugar issues, because it kind of releases the carbohydrates or the sugar slower, so it doesn't create a spike in blood sugar.
And so we've got another question. I mean, this is great to have these questions. Um, does Food and Friends sell a cookbook that people can buy?
That's a great question. So we don't, however, we do have a lot of really great recipes on our website. So if you want to try one of our client meals or kind of a fun take on one of our client meals, I encourage you to go to our website to find those recipes. And also, sometimes Becca and her team do cooking demonstrations. We have those available on YouTube. So that's another great way to get our recipes and also watch them being prepared and learn about them and learn about our services while you do that.
Yeah, a lot of them are on the website also, actually. You can find them.
Great.
Yeah, thanks.
So I'm just going to give it a minute to see if we have any other questions, but it's wonderful to have so many questions come into us. Okay, Cameron, I think we're back to you.
All right. Thank you, Buffy. Thank you, Becca. And thank you, Carrie. Now that we are done with the questions, that will conclude today's webinar. So thank you all for joining. If you have any burning questions that you did not get to ask, please submit it to Buffy via email at bdwatts@foodandfriends.org, and she will be happy to direct it to the appropriate individual for response. Thank you all so much for joining.
Take care, everyone. Good afternoon.